All right. I think some folks might be coming in a moment, but it is 10:15, so we'll get started. Thank you all for being here this morning.
I'm Natalie Willens. My pronouns are they, them, and I teach at LaGuardia Community College and City College, and I'm really excited to be here to facilitate this roundtable here with incredible organizers. Mattie is going to frame the conversation for us, and then at the end we'll have a Q&A.
All right. I want to just start with like it can stay open for a minute. If it gets distracted, we'll check. I want to start just like with an emphasis on gratitude. I'm really grateful to be here with my friends. Really grateful to be here with my friends. And I've been thinking a lot about friendship as a method in my research. So I'm a graduate student, PhD student here at the Graduate Center in Urban Education. I am a trans femme organizer, activist, amateur photographer, but I've been thinking a lot about friendship as method and ways to both for praxis and conceptual building as well. And so I'm thinking about the echoes of Jose Esteban Munoz and Jafar Sinclair Allen, who talk about citation as praxis. And I want to go back to, I'm going to use the slideshow real quick. I want us to think about like building back in 1991. So 1991, the Grad Center was near Bryant Park, where the SUNY optometry is, and there was an occupation of the Grad Center in 91. And these are two artifacts that came from that occupation. The left is a flyer from ACT UP New York's Latino, and Latina caucus, writing about their solidarity with education as a right and healthcare as a right. On the right, you also have a flyer from CUNY students. We're all in this together, supporting the picket line for home care workers. And when we think about unprecedented coalitions and friendship as method and the relational praxis of refusing disposability and building the worlds we want to live in, I want to call in this deep history and overlap between CUNY and ACT UP New York, between educational activism and healthcare activism. And I want to just have some affirmations. So healthcare is a right. Education is a right. Fund people, not bombs. Fund healthcare, not genocide. Fund healthcare, not warfare. Fund housing. Fund climate. And ACT UP New York, also on World AIDS Day, you'll see one of our posters here. We did a Healthgate campaign, really trying to underscore and emphasize the dismantling of healthcare that is in our current here and now, as Jose Esteban Munoz talks about as the prison house, the here and now of the prison house. And all my friends are people who I have learned how to ask for a different world and think of another world being possible. So I want to just be really grateful for the people here with me. Tax day was on Wednesday. And the average US taxpayer contributed $4,000 to military contracts that are funding the Israeli American war machine, that are funding genocide, not healthcare, not housing. We mourn the global devastation our fascist present presents through white nationalism. We've seen the dismantling of PEPFAR. The CDC has eliminated 5 HIV prevention branches. There have been over 4 million cuts to minority HIV/AIDS funds. NIH research has been cut 40%, canceling numerous grants. And we must fight for a cure. So with all of this in mind, and with so much violence in our present here and now, I am really, really grateful to be with a bunch of skilled organizers who ask for a different world and each do different things that overlap with healthcare as a right, education as a right. So we're gonna go sort of in a arc here, and each person is gonna introduce their work. but also thinking with Elie Claire's keynote yesterday, I want us to really think about the refusal of disposability when we think about care. How do we refuse disposability? How do we navigate violent institutions and provide direct care? So thank you so much. I'm Mattie Beaton. I use she and they pronouns, and I'm just really thankful to be here with my friends.
Thank you, Mattie. Can everyone hear me okay? Should I bring that closer for the audio recorder? Yeah. Okay. Is that better? My name is Capone. I use he or they pronouns. I work at Bank Street College of Education, which is a progressive graduate school. They also have a school for children on the Upper West Side. And I am also a PhD student at Teachers College at Columbia. And I was connected to the lovely Mattie through Dr. Megan Madison and was working on a paper to talk and really uplift the organizing that happened in the CEC2 district. So I'm also, I will in a second read a little bit from Dr. Megan Madison, who gave me something to read and couldn't be here today. But I'll just say in terms of like my work and organizing, it really happens in the way, like, Mattie, I love what you were saying about envisioning the world we want to believe in. And a lot of my work happens like within organizations. And so thinking about like culture change in organizations. And for me, sometimes, I mean, it's not simple, but it's as simple as existing and as existing as a trans person and like showing a different way of being and providing educators with tools to empower the folks in their classrooms, whether it's graduate students or children. I think of my work as like really having a ripple effect. And so like if I'm providing an educator with a tool, that educator is providing a student who's an educator who then goes into their classroom with children or whatever the age might be and can provide those tools for different ways of being. And so that's a little bit about my work. And in my graduate studies, I'm really curious about the experiences of trans people who teach and making the connection between anti-trans legislation and the ability for one to be their authentic self in the academy, which is such a violent institution, and that could be a whole panel in and of itself. So I'll just read a little bit about Megan and what she sent over. So Megan Madison, her pronouns are she, her. She's the founder of Aunties and Friends for Liberation. And she published her first book, Our Skin, A First Conversation About Race in 2021. It was based on about 5 years of work in New York City schools, facilitating anti-racism workshops for educators and families, and almost 10 years of doctoral research on critical race theory, combined with training and classroom experience as an early childhood educator. So that was, our connection, and I'll talk a little bit more about the paper in a bit, but that's what I am. Thanks.
Thank you both. Good morning, everyone. My name is Elie. I'm assistant professor at the NYU Grossman School of Medicine, and I'm a practicing gastroenterologist here in the city. I was introduced to kind of CLAGS, Mattie, through Elie brochures, Matt Grimm, Laura Westengard, and we met in a class we took together, part of the LGBT advanced certificate here at the center. And what I do, other than providing care, that is a part of the work I do, the other work is research and education on healthcare disparity, especially for LGBT folks who have either Crohn's and colitis or other kind of chronic gastrointestinal comorbidities. My interest in all of that really stemmed by our inability as medical providers to not pathologize queerness and kind of doing a little bit more research, qualitative work on kind of interviewing colleagues of mine on what defines as high quality care for Crohn's and colitis patients. I really found that we cannot really go beyond using a pride flag. So healthcare is way beyond just a flag or a pin that you place. So there's a lot of things we need to learn in medicine. So that's kind of why I'm here and how I got to be here. Yeah, I mean, historically, just kind of to link in what you mentioned about disposability, historically, marginalizing LGBT folks or any other marginalized communities really doesn't end up well. We've seen that through the AIDS epidemic that happened in the 80s and 90s. And well, that was a really bad example. But then a much better example was Mpox cluster that happened a couple of summers ago. That actually showed a more successful campaign on how to curb, for example, an infectious disease cluster. But nonetheless, really beyond HIV and AIDS, there's a lot of other slew of medical problems that can be really targeted and tailored for queer folks. Yep.
Hi, my name is Nottage, and I use they and he pronouns. I'm an independent art curator as well as a healthcare activist with ACT UP, along with Mattie and Rachel and Ivy. And I'm also a co-founder of the Come Forever Garage in Los Cerros, Brooklyn. The garage is both a free store, healthcare mutual aid space, and a multiply accessible social space that's mask required and has wide entrances and a large bathroom for mobility devices. We offer free HIV and STI testing twice a month, free clothing, N95 and KN95 masks, COVID tests, drug testing strips, condoms, Plan B, shelf-stable food, first aid trainings, all for free. And we also encourage anyone who's interested in hosting events there to do so, also free of charge as long as they're into doing it accessibly. We've hosted writing workshops, film screenings, somatic movement classes, zine folding, Halloween concerts, DJ open decks, holiday speed dating, lots of birthday parties, and karaoke nights as recently as last night. You can find us at comeforever.net, COMEFOREVER.net. Thanks.
I gotta have a party at Come Forever. I didn't know that we could do that.
Have your birthday party at Come Forever.
I'll do it. I'm Rachel Joy. I use they and she pronouns. I met Mattie through ACT UP, through the trans working group. And my day job is in social work, harm reduction, social work, but I organize primarily inside of Rikers. I've been teaching and doing religious services in the New York City jail system for the past 5 years. And most of my work is working with folks who are currently inside, bringing outside volunteers, service providers, people who generally folks inside don't have access to inside to do classes, religious services, and just general community building. So much of the question of disposability, so much of the jail system is a intentional means of disposing of people, of isolating people, of physically separating them from their communities, but also separating them from care, separating them from spirituality, from joy, from all of these things that keep people alive, both in body and in spirit. And our system works very hard to try to dispose of people, and the work of building inside-outside relationships fights against the disposability of the incarceration system. Also then creating relationships with people once they're released and have a community to go into, especially folks who are detained in New York who are not from New York, who don't have community in the city. And the other work that I do is through the New York City Resource Library. It's an online database of 600 free resources across New York City: food, clothes, healthcare, queer and trans resources, showers, sex worker resources, community spaces, places to go to just meet people and create somebody who knows your name and somebody who knows your phone number and someone who you can call if you get arrested, and somebody who makes sure you're not disposable to the systems that really want us to be. And also a physical distribution of Narcan, fentanyl test strips, trans tape. We've got binding tape, healthcare supplies, sexual health supplies, COVID tests, kind of whatever people are willing to give us to give back out into the community, and usually in queer and trans community spaces where folks are particularly marginalized in the healthcare space, getting access to as much as we can healthcare wise without having to navigate all of the systems.
Like when they ask you, come to the table, the table's small. Hi, good morning. My name is Kwan, Arce. The this introduction, I guess, we start by that I'm a mother to two HIV negative kids. I've been HIV positive since 1990. I was part of the group in the 90s that was called the People with AIDS Health Group. So we were the first buyers club where we imported medicine before we had the current treatments that we have that to be able to survive. So and also in that effort, we taught ourselves how to create our clinical trials. And I guess it would be good to take a moment to honor Iris Long, who passed away last week, and was part of part of ACT UP, somebody that worked in the pharmaceutical and clinical trials and taught us to navigate all that in the 90s. I'm a member of ACT UP because where else would I be? Haven't really left it since 1990, and kind of stayed there until we had the protease and heart. Left for a while and was asked to come back to work on PrEP, and then I recommitted again during COVID. So I'm also the board president of Treatment Action Group, which is the group that spun out of ACT UP that focus on the science and the stakeholders in the space of negotiating new treatment. I was a member of Ryan White, who took consecutive voting terms. And in 2021, I created the New York Pride Health Fair with ACT UP and TAG, re-engaging community that we built, like calling the Department of Health to show up to help us vaccinate for COVID. And the following year, we dealt with the issue of Mpox as well. But we created the same elements of re-engaging partnerships of over 30 years to show up as clinics were closing, and so we access all the harm reduction items and testing, and reconnecting like healthcare back into the community. Two last things, I'm a New York taxpayer and a voter.
Thank you. This is the call that IDU wrote last summer for the health fair. And I think there's a lot in here that connects to this question of direct care and refusal of disposability. I think just the basic frame that our government is against our survival for so many of us, especially queer people, disabled people, trans people, Black and Indigenous communities that have social determinants of health that are much different than affluent white communities. And I want to sort of talk about the navigation of violent institutions. So how does your work navigate violent institutions and present alternatives for direct care? In your bios, a lot of us touched on that already, but if there's anything else you want to add about how we have to navigate things like the Department of Health, things like institutions that we know are for-profit, et cetera. So anyone can jump in if they want, or we can go on this more.
Yeah. I mean, I think one thing that comes to mind, I think thinking about the disposability, thinking about from my perspective curriculum, so like what's included what's in a curriculum and representation and access to learning about our histories, learning about stories. I think that's something that comes up a lot in my work. And yeah, that thinking about the disposability of how in this current moment, how easy it has been in some parts of the federal government and Department of Education to really dismantle curriculum and kind of the ripple effects of what that means for learners in New York and beyond. I think a lot about fractal, this idea that Adrienne Marie Brown has really uplifted. So like how we are in relationship and how we are on the small is really how we are at the large. And so I don't know. I think for me in my work and thinking about organizing, it's really each person. So like really being in relationship with each person and how that really can help me build the world that I want to see. And I'm going to read something that Megan had wrote that I think really relates, which is about when she started showing up to school board meetings. So she writes, when I started showing up to school board meetings in District 2, I learned that in New York, like in many places across the country and around the world, it's the same small group of billionaire-backed bigots who want to limit classroom conversations about race, segregate schools, ban books, expand standardized testing, criminalize pro-Palestinian activism, welcome ICE into our schools, and villainize trans girls playing sports. The flip side of this terrible reality is the potential for building a broad front against our shared enemy. We learned in CEC2, so Community Education Council District 2, which is a school district in Manhattan. We learned in CEC2 that when we bring people together around local campaigns, authors who care about the freedom to read, trans adults who care about trans youth, parents who care about kids with disabilities, teachers who care about Palestine, clergy, professors, alumni, students, we can build community and make real change for the children in our own neighborhoods. It feels great to win, I'm not going to lie, but even when we don't, it still matters to the kids in our own communities to know that there are grown-ups who are trying and who are willing to show up and show them that win or lose, their lives are worth fighting for. And I think like where Megan and I and Mattie and the project that we worked on and where I think about my own positionality is like really trying to leverage resources within institutions. So it's like if I have a speaker fee budget, who can I pay? Who can I bring in to uplift their voice? And like how can I leverage the resources within the violent institutions I'm a part of to really further the organizing work in the communities I'm a part of? So that's what's coming to mind.
So I think the answer for your question, Mattie, at least in my field, is a little bit two-layered. So there is violence in medicine itself as a discipline, and then there is violence, I think, within institutions or buildings or universities and whatnot. So for the first one, talking about violence in medicine, I mean, unfortunately, medicine has been violent almost to every single human on this planet. I mean, we do poke and probe people to get samples and blood and procedures and whatnot. But when it comes specifically to the queer community, it's a little bit even more than that. It has really been kind of a struggle in the past. I think maybe, I mean, we credit modern medicine to have kind of started in the early 1900s. It has been a struggle really fitting in queerness within a model where medicine really has to be very binary. You're either sick or not. This is, you have 10 fingers or you have less than that. Things that kind of similar to that. One of the things I've learned during my time here is kind of using or utilizing queering methodology to fit medicine into it and vice versa. So trying to merge this binary system versus a non-binary system. So that by itself has been more difficult than I kind of thought, obviously. That's why I'm doing this. And there's a lot of work to be done. So there's a lot of unlearning to be done, and there's a lot of learning of new skills, new theories, kind of to put in practice to help patients. So there is that as in medicine. Institution-wise, as we know, one from this administration on the federal level and down to the very much city level. But I mean, there is the sentiment of the administration itself, but there's also their acts. The new big, beautiful, ugly bill, whatever that name is, by itself has really kind of is going to change healthcare by itself for the long run, putting institutions on the brim of kind of financial non-stability or non-sustainability. With that, institutions are trying to fight and find a way to kind of curtail either care or curtail other services that they kind of provide, or they have always provided. And then there's a sentiment of the federal government, especially when it's for anti-trans care, that some institutions more than others have bent the knee, and there is that form of violence that is more institutional rather than the discipline level that I've talked about earlier on.
Thank you. With my work, I take a three-pronged approach. So it's kind of like thinking about accessibility on cultural front through curatorial practice in art galleries and museums, and then on a legislative advocacy and civil disobedience front, and I work with ACT UP, and then by meeting the immediate like food, clothes, health supplies needs of myself and my neighbors by providing a physical space as a gathering and redistribution point of the garage. So the cultural front is creating pro-accessibility theory and propaganda so that people understand it and want to be a part of the movement to liberate accessible free healthcare for everyone. Legislative advocacy is widening access to free health services and supplies for everyone all around the city. And then the mutual aid is then providing these services and supplies on a smaller scale in an intentionally social environment and modeling what the state could be providing in the meantime of them doing it. So they can't say like, it's impossible because we're doing it already. And then so others can copy the model and say, actually, it's easier to live, you know, when my whole neighborhood is like pooling resources. And you don't have to be like a nonprofit to make that happen. It's just like, oh, like we're all just like setting up a folding table once a week. Yeah, which I think is, you know, kind of similar to the work that Rachel was doing before.
Yeah, I think also two fronts with this question. When it comes to the like abolitionist organizing, I was talking to somebody recently who said to me, you know, if you want to burn a building down, you have to make sure you get your people out safely first. And that really stuck with me as an idea of like organizing in Rikers is the most violent institution I can think of to be in. And I feel lots of complicated ways going inside and being in that space, and just the physical space I find so violent and upsetting to even just like be in as a free person. And doing relationship building inside of there, and on the outside, there's many incredible people and organizations doing legislative action to try to change the policies around incarceration. And I think the jails exist now and the prisons exist now, and building communities and coalitions with folks who are inside, with folks who are directly impacted, who are formerly incarcerated, is the path forward. I think a lot about the Ruth Wilson Gilmore quote, where life is precious, and the carceral system tries very hard to make sure that life is not precious there. And so standing in a dorm area in a jail setting that is designed to make life not precious, having like singing spiritual songs together and drawing a comic strip and teaching a debate class and doing all of these things together in community helps create a little bit of preciousness in this really violent and isolated space. And I think that is, for me, the way that I see navigating these violent systems is trying to create as much softness and as much community and relationship and gentleness and preciousness with the folks who are most impacted by them. And then the other thing, similar to what X said, is just getting supplies in people's hands. It's so hard as a disabled person who has a lot of privilege. It's incredibly difficult for me to get access to the healthcare that I need. For folks with way less privilege, especially class privilege, getting access to basic medical care is near impossible in so many places in this country, in this city, in our communities, and just trying to get as much resources into people's hands. Also, like care navigation for people who have privilege to know how to navigate the system and have been able to have the free time to navigate the system, doing that work with folks who just need care in their hands now.
Well, I guess I've been doing this for some years, maybe longer than some I've been alive in this room. For me right now, a lot of the work is about showing up still after so long to have a relay kind of mindset. A lot of times people do ask me, why do you stay when a lot of active has left the floor? And I have struggled a lot running back to the fire. But underneath all that, it is the relay team, the way I was relayed to do this work. And navigating from spaces of violence was just continuously, and I don't know if it's a place of privilege when we say sometimes, is that what is important for me to be able to do this work is actually not romanticizing our wins and our history. Because within community, it's also very violent, and I think we often forget to talk about that. Because there's so much work to do that I have been able to reserve that space into navigating, into negotiating with the people that are not in the room, people that are not sympathetic perhaps to us or whatever, or people that have skill sets that we need to move forward, that we're uncomfortable of dealing with. And to be specific, like dealing with people like in science, people in finance, people in technology, and pick the things that we need to craft to move to the next step. Because sometimes when we're just within us, it's just within us, and then we're just stirring what we know, what we heard, and when we really need skill sets that are beyond. For example, I just have the minimum education to just not have to go back to school, and I had to learn how to navigate that. And I could only do that through engaging with like very difficult understanding that I was undereducated, understanding, but I needed to engage the idea that everybody's a stakeholder. People that had issues with homophobia in the early 90s, somewhere along their lives had somebody they love, and using that as a tool to navigate that. So collaboration with everything that is uncomfortable has been my method of navigating violence, because otherwise that's all I could focus. And when you are burying 500 people in a month, there is that luxury whether you're just only trying to navigate the violence versus showing up and crafting that transformation. So I'm somebody that lived through a time where HIV positive people were even asked to not show up at Pride because of our allegiance, and we tend to forget that. And that is where it hurts most. And I have been able to see the work where people have transformed, which, like, you know, for better or worse, you see like a corporate pride now where everybody is, and there's merge and all that work. There was a time where we were asked to not even show up because of the way we express illness. So I think it's important to just like seize the day every day in engaging the people that press us, that may not know that they need to work with us. Because at the end of the day, we all are going to be experiencing illness and death. So there's that common thing that we can always work with. And every win at the end of the day has been relationships with people. Thank you.
Speaking of relationships, from one-to-one patient care to inside and outside of prisons and jails, empowering children to organize within their school districts, to finding unlikely pairings across generations, languages, and technical fields. How do we navigate these complex relationships when they come into play? And where is class in that conversation of the relational as we are navigating the futures we hope to build and the pasts that we are also like inheriting and looking to build those futures? Where does class come into play in our relationship? I feel like we can also, if anyone wants to jump in, we can break the arc and be a little more disruptive and queer with it.
Good place.
You've been called out, right?
Yeah, okay. I wasn't prepared to be called up. Well, I mean, I think specifically with the New York City jail system, with Rikers Island as an institution, it is a class-based institution in that 85, almost 90% now of the folks there are detained pre-trial, meaning either arraigned by a judge or about 60% held on a cash bail. And so by default, if they had more money, they would not be incarcerated. If they had more money, they would have access to the healthcare of the outside. And if they had more money, they would not be isolated in this setting. And if they had more money, their risk of death would be significantly less. 50 people have died on Rikers since 2020. That is an egregious number and is like directly tied to class. And those folks, most of them would not have been in a position to die in jail if they had more money. And so every conversation and every relationship that I have with folks who are inside, class is really at the forefront. I am coming in with so much privilege. I'm a white person, I'm a free person, I'm a person with class privilege. And I think in the relationship building aspect, the class privilege is always at the forefront and comes up the most in my relationships and in conversations. And there's just no like large scale funding to get people out. There's like incredible bail support projects who can do small amounts, especially when New York City had dollar bail. And now there's people, so many people being held on just like astronomically high bail numbers and no one able to pay it because of the way that the infrastructure of capitalism is working. And that is such a heaviness in all of the relationships that I see with folks inside. And then when they come out navigating class and capitalism after just having spent all of their time inside, so many people lose access to their bank accounts if they even have them in the first place when they're inside. And I think class dynamics is like even more present in my relationship building than any race dynamics or free, not free dynamics, just because it's people know in that moment. Of course, race and gender and ability status also play into who's incarcerated and who isn't, like, to such a high degree. But in that moment, for so many folks, they know that if they had $10,000 more, they wouldn't be inside. Yeah, I don't have a good ending because I wasn't prepared. That is it. And then also with the resource stuff, just all of this stuff should be free all the time, all for everyone ever. And getting it into people's hands feels important and feels like it should be done automatically.
One, if I want to talk about, again, healthcare and medicine, I feel class is one of the strongest dependent variables that affects health outcomes and medicine and health in general. I mean, people are usually divided into some categories on that. One thing I want to talk about is, for example, healthcare insurances. So we have the third-party big insurance companies, and then we have Medicare, Medicaid patients, and then we have VA patients. Maybe these are a category by themselves that I think I want to exclude a little bit from this conversation because they do have almost Medicare for all. And then we have the uninsured. So you cannot have a conversation or any work in medicine without really focusing on class, because you will be seeing the patients who have the insurance that you take, right? And one of the big kind of conversation we have currently in medicine is, are you taking Medicaid patients or are you not? As an institution or as institutions in medicine, they really need to take Medicaid patients because CMS, which is the Center for Medicare and Medicaid Services, will not accredit or fund the hospital if they don't take any Medicare and Medicaid patients. Though there is a little bit of a loop there where some providers are either forced or on their own volitions do not want to take Medicaid patients because they reimburse less than private insurances and whatnot. So that by itself really limits a lot of the care that LGBT patients or queer folks will get, because unfortunately the way this capitalistic society is built is that a lot of queer folks can only afford Medicaid, and kind of vice versa. So, for example, when there are only 2 gastroenterologists in my institution who see Medicaid patients, that creates by itself a bottleneck and an inequitable access to care to start with. And then think about the tests that needs to be done, the treatment regimen that needs to be done, sometimes a hospitalization, sometimes a surgery, and all of this will actually affect and trickle down to a worse outcome in LGBT folks only based on their insurance and then on their kind of class status.
Anyone else want to jump in on this one?
Yeah. Yeah, I think I really liked what Ivy said at the end of the last one about like everyone's a stakeholder. And I think like some of the work with kind of creating health services for all is to like get rid of these ideas of class, because there's no like tiered system. Like with the sexual health free clinics in New York City, it's like a lot of us might have the idea that kind of like, oh, like these are like for someone else, like until you get to the point that you like need them, and you kind of never know when that's going to be. And they operate without, like, you don't need to have ID or insurance to use these services. You don't need to have an appointment, you just go. And so like this grand like equalizer outside of class is kind of like, you know, like everyone gets sick, everyone dies at some point. And so yeah, so like these clinics are like really amazing that they have, like they're open from like 8:30 a.m. to 3:30, like 4 days a week. And so, and then the city doesn't advertise them because they don't have like enough bandwidth to take like an influx like that. But they could, and they could be prioritized outside of, because they're like state funded and outside of like the Medicare system, partially. And then it's like if these sexual health clinics and the COVID flu RSV Express clinic services were open 6 days a week with multiple locations in every borough, if we pass, like there's an act that I don't know if maybe some of you know about it. It's been in the New York Senate and Assembly for like I think decades now. The New York Health Act, which would be universal free healthcare for everyone who works in the state, including dental, optical, long-term care, gender-affirming care. And then if we had like, you know, like a universal housing program to even get people like a baseline studio or SRO apartment, then like a conception of class becomes completely different because you're not really working in those tiered systems so much. And I think like another thing that I think about in New York City specifically is kind of, we have this like massive really amazing actually, like free condom program, where you can like run into condoms without even trying to, like in but I think that it's like really important. It's kind of like you don't have to like seek them out. You're just kind of like, oh, they're like at this bar, like in this bathroom or whatever. And so I think like it would be nice to have a program like that for like KN95 masks, like if they were like in subways or on buses or libraries and hospitals. Because like right now in New York, if you don't have internet access, there's nowhere you can even buy a KN95 mask. And even then you have to like know where to go because half the ones on Amazon are counterfeit, so they're going to be hard to breathe in, and then they're not going to work as well. And you're going to be like, oh, masks are hard to breathe in, but it's kind of like it shouldn't be like an if you know situation. And even like the health department puts out ads admitting that you need to be wearing like KN95 or better protection in order to protect against viruses when other people aren't masking as well. The city doesn't provide them. You can only really find surgical masks in stores that don't offer that kind of protection. And you know, like we have them in the garage. There are other organizers that like crowdfund and buy a bunch and redistribute them called like mask blocks, but it's hard for most people to get them in the city. And it's access to these preventative healthcare mechanisms that often determines like what kind of lives that people get to live. We see it with condoms, like everyone doesn't live in a place where they can get on PrEP or where they can have an abortion, but if they can get a hold of condoms, it could change like their whole life path. And so like with the K95, not everyone has access to a good doctor or even the vaccines. But if you can stop yourself from getting sick in the first place, or even getting sick as much, it could change your life. And before 2020, like we actually didn't have that technology. So it's like we're living in like a new world. And I think that's really interesting to think about cost-wise.
So I think a good follow-up, like you had mentioned, Rachel, there's items that we need, they should be free, but there's a cost in everything. Somebody's making it. So the way I analyze this is that there is money. It's just that it's not about being free the items. It is it's like investing. So there is money. We just determined that an average we're sending $4,000 of our tax money, right? It is being able to work the best system and ask for that money back for what we need. And that is a lot of work, but that self-financing probably is the most important thing for me as a tool and as an activist. So in all the clinics, like when you have mentioned condoms and whether we could do the health fair and the mask, is being able to take advantage. I think like in New York, we're just very lucky because we take the subway together. We go to school. There's so many activities that you run into people that have access or that you can, or you're the access for them. Learning how to stitch that is perhaps like an ongoing practice for me. Until you can self-finance one way or another, whether you're reclaiming your taxes or asking your representatives to take that budget and put it where you want, it really is the solution to a lot of the things. I mean, Germany does it really well for healthcare, where they actually have worked it evolved so much that how they cover you comes from your sense of like what you want and how comfortable you are. So we have models that happens, and we're the richest country. So what I would say, like, since we're in the space in a university, is who you're spending your 1 year, 3 years that you need to recharge as finance and legal, and imagine the world so that you can reclaim that money that is owed to us, how we want to share it. We don't want to share it to ours. So like, what does the work look like? You are next to the next informed lawyers. You're next to the people that are going to be elected. So I constantly say that. And once you're ahead of the path, when you're running a clinic, for example, hire activists with experience, because when the clinics are closed because they've decided that people are not coming in, somebody's sleeping in their job, right? So how do we keep that? Only an activist that has worked on the ground can bring that. For example, the Department of Health, the reason we have condoms is because for 40 years we've been working on that. It was ACT UP that made it possible to have them financed. The Department of Health is a legacy of activists. So like, instead of like being in a position that they're not doing their work or whatever, we have spent 40 years of relationships and they work for us and they are us. And that's important because one day you're gonna be in that position. Everybody that's an activist today is gonna be either doing it for free or being hired in positions that can navigate the system. We were able to imagine when we had nothing, Ryan White, which I would want people to study really in depth of that, because there is no federal assisted health structure in this country that looks like Ryan White. We've had it since 1990, where we used to get $900 million from New York City and another $900 million in California and in Florida. We were able to do that when we had nothing and we were 20 years old on average. The fact that that continues to be accessible, less budget, but it's seeded so much work, including clinical trials to like basic care, like feeding through God's love. It is the only federal thing that exists this long. People in Sandy that lost their house still don't have their house. There's a tornado, people leave, people haven't even finished that conversation. But this is an example that we have a history that we were able to do that, and people should copy that. I failed in helping COVID to build that structure out of like all our mistakes and our win. It is so hard. History gets erased so quickly that I thought that if COVID had used Ryan White as a structure, healthcare in this country would have been so different 6 years ago. Because unlike HIV that you can categorize as this group of people, whatever, COVID was everybody. But because we did not have a relay of activists beyond the HIV population, it just became about talking about the violence of it, and nobody negotiated. People, the families with COVID and people that had COVID had the entire platform that election year. And we saw how much money this country has. I mean, it's nothing compared to what we spend. What we spent during COVID is nothing to what we drop every day and more. So we need to learn how to negotiate that. Even if they give a 10th of the percentage of what they spend on the war, in one day, it will look like the help that we got in COVID. And we can say what was sufficient or not, but we saw the money that could roll up. And I'll just say another example is that I've always advocated that this work also needs to go into hospital institutions. I have said during COVID is that the hospitals should invest on having their own pipeline of making masks and PPE. And of course, I know what the numbers are. It costs 15 times more than buying it from China, but it doesn't matter. When you say like, you cannot consider a cost 15% more as a deficit. It's like the way when we did HIV clinical trials on site here, and we demanded that because otherwise we had to go to Maryland, and nobody wanted to go to Maryland. Pre-internet, we said, if you bring it here in the clinics here at the doctors, you will get data. This is pre-internet. That concept took 5 years to execute because it was never done. And when it was done, immediately we were able to like have path to finding a cure. But it's important to say things like, if your budget comes out 15% more, 20, 50% more, and they tell you they can't do it because it costs so much, sometimes it costs money for solutions. You cannot stay in the discussion, well, we did it this way, we're never gonna do it. And I think we just had a conversation with, who do we have? We had a meeting with
Senator Butcher?
Senator Butcher. So I said, you know, what is important is that right now you start working on withholding some taxes because we're a taxpayer, I don't know what it's called, gifting to other states for healthcare that vote against us. And I'm not saying withhold all the taxes, but we need to withhold taxes because we're seeing how insurance is being cut off, how transfer is being. So what did they said to me? We cannot do that kind of stuff because it's like gerrymandering. But it's exactly that is where you have to push back. That is a state of mind because you cannot say that gerrymandering is just this low tactic because the Republicans have used it and won. So it's how you engage in that and change the way you perceive what history told you. Just like in HIV, they told us, well, you know, clinical trials that take 15 years, whatever, and we show them that it didn't. We can have markers when something doesn't work, that they can stop it. We don't need 15 years for you to tell me that doesn't work. And that has changed the landscape of science for not just HIV, but for everything. So that frame of mind of like how you negotiate things and how old those thoughts are and how you need to like push back and engage the people that you know, like in you, especially the guys, the people here that are in university spaces, got to tap in their economics and legal to work this out, to push the next path.
Thank you. Before we open it up to everyone, we have sort of like one last frame, which is who's missing from this conversation? And then we'll open it up for questions from everyone else. So who's missing? What legacies do we also want to think about with who we would like to call into this space? Yeah. Do you want to go here? We can go.
Yeah, sure. Well, I'll answer that and answer a little bit. I mean, so much knowledge. I'm so grateful to be just like a listener and a participant in this conversation. I mean, I think in thinking about my work and this project, really the trans children, and that was brought up in the planning call too, the trans children that were a part of this organizing are not here, right? I think there's so much wisdom. Yeah, and this was from Transformative Schools have hosted an art build, and on the right, the Trans Kids Are Magic was at Interference Archive in Brooklyn, which is an amazing archive, and another art build. And I think the relationship and class conversations or, you know, concepts and thinking about that together, for me, you know, I'm just thinking about what Ivy, what you had said towards the end, like what Republicans have used and won. And in this organizing work, a lot of the conversation was like, not really how did this happen, but really contextualizing like this happened in New York, the state of New York, the city of New York, you know, New York City, in the richest district in Manhattan, right? So the Moms for Liberty was founded in 2021 by 3 Florida school board members. Originally, they were mad about mask mandates, also all of these kind of intersecting issues, right? And a month later, they were featured on the Rush Limbaugh show. And then in 2022, they reported $2.1 million in total revenue, which came mostly from contributions and grants. And then in July of 2023, the organization has 285 chapters in 45 states. So it's not a coincidence that in New York City, Moms for Liberty targeted District 2, which is one of the whitest and wealthiest districts in the system. And Place NYC is also another group, and it's the existing conservative parent group that's been fighting hard to preserve school segregation and expand racially discriminatory standardized testing for years. So it's wealthy parents. Think about class. I mean, such an intersecting, all of the isms and all of the things, for lack of a better way of saying it, are so interconnected. And when I think about this, you know, and think about art, that's something that, you know, the title of the paper that we had put forth was Fighting Fascism with Joy and Rigor. And so thinking about, and Ivy, what you said towards the end too, about like using institutions and universities, like, can we put this paper forward? Think about authorship, think about like who would benefit from being on this paper? Can we get this paper to be published so that then these groups can apply for grants to get some money to do more organizing and pay organizers, right? Like that's the fight. And I think using, for me also, and what was such a big part of this paper and a big part of the organizing was using art as a way to also create access. So like who's missing for children to participate in different tactics. When children were in the room, there were different tactics like, I think it was called like a human bleep, where if, you know, someone who was testifying was saying something that was really transphobic, there was a human bleep, or people would, there was the Macarena, and people would, you know, turn around and sing "Hot to Go." Like there are all these different tactics that were really disruptive, and that I think were such a part of the story of organizing. So who's missing? I'll say trans children, who are part of that fight, and really just thinking about different ways to have folks access the organizing is such a big part of what I have seen as part of the fight.
We have 15 minutes left, so if anyone wants to answer the who's missing, and then I'd love to have some Q&A.
For me, I think in the decision-making rooms, patient activists, that's where we're missing. Queer patient activists, I think have been missing. We are starting to make a little bit headway in that by creating better representative community boards to help, like advisory boards to help with our research projects and grant writing, but definitely we need more.
Just thinking about everybody who is in the jails and prison system, in immigrant detention, there are certainly some really remarkable folks doing organizing while incarcerated, while detained, but their access is so limited and are not able to be in conversations and in spaces like this. People who can't access higher education institutions, everyone who has died at the hands of the carceral state, who has died because they didn't have access to life-saving healthcare, because it was too expensive, or because they didn't get it in their communities. Just bringing those folks into the space as well.
I mean, for me, obviously, it was the people that died of AIDS. You know, we would have lived in a different world, knowing that how much talent, how much intelligence the world would have been, and not just the people that had AIDS in the United States, globally. You know, I'll call out like the women in San Quentin in the 80s that actually reached out to ACT UP and said, women are dying in prison and we don't know what it is, and call us in. While they had heard of ACT UP, but we didn't know for other people other than the LGBT center. So they taught us care, how they were taken care of by using like simple things like aspirin to just like get through the day. Their practice of organizing with nothing in prison and like you know, high level security with nothing in the middle of the desert. We were able to trace their activism, and that spawned the health group in some ways of how do we like problem solve when there's nothing by, you know, importing drugs that were not approved, that we tapped into, that you have the right to use it. And then being able to actually do a circular thing, actually, that you would be interested, is that the women in Rikers could not get treatment for just anything, but we were able to finance that and got the contract to just go in and ask them, because they were supposed to do that, is the law, but nobody was doing it. So we wanted the contract, and there was a lot of paperwork about like we can't afford it because of blah blah blah, and we said you don't have to afford anything because we have our own money. We'll bring the care, because at that point we had done like the full circle where we could self-finance. So all it was a stamp for them. So that's like how we turn that that like super impossible by having agency with money and legal to work those things. So that's like what I said is like investing in the relay. Who else is, so I'll name Sally Cooper, who was a farmer and an active member that decided to just work on this puzzle of how do we self-finance, make enough of a business that we can actually take the care to Rikers and take the data of all the stuff that we're importing, so they become points of clinical trials to advance them, which we did. We actually helped people curb the death from KS, the cancer that you get that most people died, through importing drugs that were illegal for this country, but was categorized for a solution to prevent you from dying for something that already existed. Who else is missing? The elected officials that we have here. They should be having meetings with us all the time. We should change the framework of when we have a meeting with them, we're asking them for something. They should be asking us. So that is the relation. That's the relationship of goal. But for that, one has to be so over study and research of why you're in that room. So that exchange is very important. So they're missing.
Okay, and then quickly, yeah, so the access that we fought for healthcare in the city is like really amazing, and it comes through activism. I remember growing up in Michigan, I don't remember the first time that I saw like a condom like on my own, that like I like ran into one. I remember, but I do remember like mapping out like the different states where you could get an abortion without parental consent with my friends and being like, well, who's gonna drive us to New York? And so I think like at least a few people in this room are here because of the types of access that we have, you know, like in the city. And we have a new healthcare commissioner named Dr. Alistair Martin. His email, you should write it down because you're not going to find it online, is Alistair, ALISTER, at health.nyc.gov. His first name at health.nyc.gov. Write him an email. The subject line could be help sexual health clinics, help the sexual health free clinics. You could ask for changes in the hours from 8 a.m. to 8 p.m. Monday through Saturday, so that we can accommodate daytime workers and school age kids. We can ask him to add COVID PCR testing to these clinics. And I think an email like that could influence who's in this room in the next 5 or 10 years.
Great. Well, thank you all so much. This has been a really rich conversation, and we have about a little less than 10 minutes for questions. So if anybody wants to ask anything, now's the time.
Coalition building is obviously so important. How have you navigated coalition building when there are also significant barriers to building those, like to building those coalitions? Like ideology or like politics that the coalition probably better off with.
I grew up in Florida, and I think about all of the people doing coalition building in the South and in red states and in places where like the danger of this work is so much higher. It's much more criminalized. And also there are way more people who don't believe in it. And it'd be, at least where I'm from in Florida, very hard to walk into a room and find even one person who agrees with the world that you want to create. But when people are dying and when people realize they can't buy food for their children, and when people parents get incarcerated and teachers get picked up by ICE all of a sudden, I think a lot of people are like, well, I have to do something about this, even though I don't care about your political bullshit. That is the political bullshit that we care about. And I think that has been, to me, a way that, since I've seen so many people build unlikely and unprecedented coalition, is just like, they have to. And there's just no other way. And eventually, if things keep going in the way that they're going, it'll be life or death for all of us, and we'll all have to. And the people in the South have really taught me so much, and I feel like are doing such an incredible job of just saying, we don't have to have dinner together after, but we do have to go get this abortion together or go bail this person out of jail together. And I think that is like kind of my worldview on that.
My approach in building coalitions is a little bit similar to that as well. I've been recently put in a situation, actually yesterday, very recently, and it's the same tactic I've used before. Is I met an organization through a health fair. From one degree to the other, put me in touch with that other third organization who had a little bit of a problem. So I was invited to talk to them about colon cancer prevention. Very, it's like for everyone. You have a colon, you're at risk of colon cancer. That's it. That regardless of who you are. And then I gave that talk. It was great. Everyone loved it. But then it was brought to my attention that they were not really happy that I do queer health because people in their community don't really acknowledge queer people and whatnot. The thing I always remind when I have this conversation, it's really struggle is universal. Pain is universal for all of us. Health is universal for all of us. And I really kind of use this sentence in a letter from James Baldwin to Angela Davis, and I think I'm going to butcher it, but it goes that he wrote her when she was in prison, and he said that they came for you in the morning, they'll come at me at night. So the erasure of freedom and the erasure of rights that's happening in this country is very silent, but will sneak up on you. And then it started with, trans kids in medicine, at least. It's going to go up to trans adults, it's going to go up to anyone who's LGBT, and then it's going to go up to anyone who identifies or looks like a woman, and then anyone who has a shade of color of skin that's non-white, and until you're cisgender, white, straight, middle-aged man is the only person standing at the end of the room. And it works. I think it works. It worked yesterday, so I don't know.
We have 2 more minutes, so if you want to ask a question, maybe one person can answer.
Okay, it's for Ivy. I know that you talked about Brian White, and the importance of that. I know there was obviously with any piece of legislation, there's a little bit of push and pull that we have to give, and probably more than we get. And I know that one of the big aspects of Brian White from a legal perspective was the requirement for criminalization in some of the states. So I know that obviously is an aspect that we would, in using it for a framework moving forward, we would want to include. But I'm curious if there were any other parts, just from the perspective of being there, that maybe you think that we could continue to build on or would need to be renegotiated.
Where it is right now, is that cycle of where we're kind of passive before COVID because we have the treatment. So I think that the people that are in the voting situation also have some erasure of the history of that work. So it's very passive. I think COVID kind of kicked it up, but they already have lost grip of it. So I think the relay concept is not as efficient when people leave the room and people don't come back, because the next people that are there do not have that vision. So it is a struggle. But when you were talking about coalition building, a lot of it's like sometimes you need to leave a state to get that healthcare, whether it's like abortion or HIV, and that's usually why our budget was so high. Because we couldn't give that much, I mean, the government couldn't give it to other states because they were against all those policies. So we embedded that people are gonna come to New York. And people are gonna go to California, they're not gonna stay in Kansas because they can't get that. But the way we saw that investment is like, we're gonna ask for that money, we're gonna focus on that money, we're gonna overreach. And when we like fall short in executing a budget, instead of giving back the money, we'll just reinvest for more clients or more patients coming into New York. Because our investment is that client that has traveled from Kansas to get, well, at that time we had no medicine, but like harm reduction, is that client that's gonna, among that population, that group is gonna go back and reinvest back into that. So like, for example, HIV, a lot of our TAG, treatment action group, is that our work for the South is actually somebody that's on ground, that has been in New York, learning the policy, getting the budgets, making sure that we give them the budget to, Housing Works invest a ton of money. In that same investment we did globally, where basically at this arch, I've seen families globally that lost parents or themselves were positive as children, that we were able to invest in that thought by the money that we had to make sure they finished the kind of schooling. If they wanted to be in science, there was a path, and now they're leading clinical trials for multiple things for TB and everything. So I've seen that 40-year arc, but it's kind of being like overreaching, because you know that in the place is so depleted, but you want that investment because in that pocket, there'll be somebody that would go back and have a bigger reach. And I've seen that happen.
Thank you so much. Yeah, it's really wonderful to have a space where not only are we talking about these ideas, but also there are actual resources out on the ground in front of us. So, yeah, Mattie has offered for folks to be able to take any resources that you want. If you want to just let folks know what you have here.
There's zines, there are stickers, there are COVID tests, there are fentanyl test strips, there's Narcan,
Condoms, you can
there's
run into
condoms,
condoms.
yeah. Bring them to bar.
Binding tape.
All right, wonderful. Thank you so much. And then also, thank you all.
Yeah.
We're talking about